Welcome everyone, my name is Dr. Mo and I'm a dentist. Today we're gonna see a surgical removal of a wisdom tooth. It's a simple step-by-step process. This one was actually quite deep. Don't forget to put a like, throw any comment in the comment section as it helps with the YouTube algorithm. Let's go. So looks like patient's already been given anesthesia. If you're wait, let's go back a bit. So if you're wondering what is this, so it looks like something that's used to keep the patient's mouth open and they bite on it. What we use in my clinic, if necessary, we call it a bite block. It appears to be like this, and this metal thing is to help retract or push away the cheek to gain more accessibility to the tooth surgery side. So they are retracting the gums from the surgery side. Mind you, this is a surgical wisdom tooth extraction, not a simple wisdom tooth extraction. So they're exposing the underlying bone, and then they use a surgical instrument and a surgical, it looks like surgical handpiece, surgical device and burr to help start creating space and also sectioning the wisdom tooth into pieces to help with its removal. Okay, so they're sectioning the crown of the wisdom tooth. And there is a water irrigant. The oral surgeon that I worked with had the surgical handpiece, I think designed with an irrigant. Okay, so they sectioned a piece of the crown to take it out, and they're removing the other part of the sectioned crown. Sectioning is like simply separating the tooth into smaller pieces so we can more easily remove it. So they're using surgical instrument to help make the tooth a bit more loose and to help push it out. They are separating the wisdom tooth further to help remove it in pieces. They're creating more space between the tooth and bone as well. There's the extraction socket. We still have remaining piece. They're trying to remove it. There's some pieces remaining more deeper inside. Oh, okay, I understood now. Okay, they're removing more pieces. Looks like a quite really deep wisdom tooth with its pieces quite stuck inside, and this is what actually happens. So sometimes we would separate the tooth for removal, but even after separation, some root tips may be remaining inside, and we need to slowly but surely remove them. You have the assistant suctioning. They're using the surgical instrument again to create a bit more space to help remove that remaining root piece. They're trying to dislodge it from its side to help remove it. Okay, looks like piece is out. This could be a surgical instrument to help clean also and remove the debris inside the extraction site. Okay, they're suctioning, they're ensuring there's nothing, no part of the tooth remaining there. That looks like a surgical instrument to help adjust a little bit and smoothen the bone surface. I assume this is what they're doing because they don't want sharp edges to be remaining. It's going to be really uncomfortable afterwards. I assume they will show us a suturing part afterwards, right? I guess yes. Again, I guess they're removing any sharp or protruding points, smoothing the surface. They're doing, I guess, some irrigation in the extraction side to help clean the socket and remove any remaining debris. I'm not too sure because they didn't say a label. I'm not too sure what they used there, I guess. To be fully honest with you, I haven't used such thing before. Okay, so they're suturing, they're going from the outside or the buccal into the lingual, and now the operator is trying to do a tie and suturing the area, or a knot, we call it surgical knot, and this surgical scissor to cut the extra parts. Okay, we're suturing the rest of the surgery side. As you can see, suturing actually takes time. It's not like a directly quick process or procedure or something. Again, they are cutting the extra part, and look at how many knots or also sutures they're used. That is what I talked about at the beginning of the video, if you remember, the bite block. So I guess that's all for today. Thank you everyone for watching. If you like the video, make sure to like the video, write a comment in the comment section below. Don't forget to subscribe, turn the notification bell on. Dr. Mo Dentist out.